Exposure. An exposure is contact with infected blood, body fluids, tissues, or airborne droplets. And the contact may be direct or indirect. An exposure to a communicable disease does not automatically result in infection. For example, if you look at some of the research done by the CDC, which is the Center for Disease Control, on HIV and bloodborne pathogens, they classify an exposure as something that directly affects mucous membrane. A needle stick is an exposure, blood into an eye, mouth, nose, things along those lines. They actually do not classify an exposure to HIV with blood on somebody's hand unless there's a cut, laceration, or some kind of exposed tissue on that hand or arm, etc., because that's protected by the skin. Standard precautions. Self-protection against all body fluids and substances this includes blood, urine, semen, feces, vaginal secretions, tears, and saliva. Diseases have been known to exist in every single one of those body fluids. Standard precautions for preventing that is hand washing. Hand washing is the single best method for preventing disease transmission. This has been proven time and time again through various studies, various research performed by the CDC, as well as other infectious disease physicians. The use of PPE and BSI. PPE is personal protective equipment. BSI is body substance isolation. And these are two terms that you'll get quite familiar with. But various methods of equipment to help protect you from pathogens. This can be gloves, face shields, masks, gowns, etc. And then cleaning, disinfecting, and disposing of soiled materials and equipment. After each run, your stretcher should be cleaned and decontaminated. You should change out your sheets. You should wipe down your stretcher with a disinfectant, wipe down all the straps, and be thorough with it. Again, hand washing is the single most important method you can use to prevent the spread of communicable diseases. This is something that's often not performed enough, and not performed well enough.